I had a growth in the back of my throat that I could see when I was brushing my teeth. And that's how it all started. Got the results and it was cancerous.
We were both scared. I knew that Rick and I had made the right decision to go with community after that very first meeting.
We did go to other hospitals. We're just much more comfortable with the way community hospital handled me in the process. We were in the car on the way home and said, this is where we're going.
That sense of teamwork was so big.
Every stone was turned and we got all our questions answered.
I know that community promotes exceptional care simply delivered, and that is exactly what we felt.
Community Health Network and MD Anderson Cancer Network. Exceptional care, simply delivered.
Healthcare facility is different in many ways from other commercial types of buildings, and that first and foremost, we're taking care of people, and we have to do that in the most effective way possible in healthcare and the safest way possible.
Our Pride values played a huge part in creating and designing our new space. Patients First was absolutely at the forefront of our mind as we designed and configured all areas of the building.
Early in the planning for our cancer center leadership and hospital leadership put together a patient-focused group.
We found that having some of the nature, colors, and themes really is something that puts people at ease, that reduces the stress and anxiety.
We went to great pains to make sure we understood the cancer center patients' experience, all the way to letting current cancer center patients try out furniture during actual treatment times to see, is this comfortable to sit in for 6 hours, or is this one more comfortable? We made furniture selections based on not what looked pretty, but what felt nice for a long time. Those kinds of things are where we make a difference.
On the campus of Community Hospital North, there shines a new building, a beacon of optimism for anyone challenged with cancer. The new Community Cancer Center North is home to some of the most skilled oncologists in the area. And Community's affiliation with MD Anderson Cancer Network, a program of one of America's leading cancer care providers, makes us a confident place to turn. Hope has a new address. Community Health Network. Exceptional care, simply delivered.
There are many different disciplines that are needed for the care of the cancer patient, and it's very important for that group of disciplines to work together.
One of the special opportunities that will come about with the opening of the new cancer center is my personal ability to care for my patient. The facility itself will house all of the services that I would normally access for my patients under one roof.
The opportunity for the patients is that they don't have to travel to a number of different physician offices. We try to deliver a comprehensive scope of services around those patients.
We have a connector to the hospital from our cancer center. This enables our staff, physicians, other physicians in the hospital to collaborate on our patients' care.
Until now, our patients who are going through radiation therapy that are hospitalized have to be transported physically by ambulance across the street to the cancer center. Now with the connector, we'll be able to provide smooth service while indoors, not having to leave the hospital physically.
We also now have a dedicated CT PET scan in this building, which allows a service that was available only once a week to be available to patients daily.
They're entrusting their life to you, and they want to know that you have thought of, if you go here and this happens, we know what's going to happen next. Well, you got to go here. We already have that worked out for you. You got to go have an outpatient biopsy in 2 hours. Don't worry about it. We're just going to take you across this little bridge. Here's registration. You're good to go. What they want to know is that you're on top of things.
There are currently only about 40 physicians in Indiana who can wear this lapel pin, and they're all with Community Health Network.
It says that doctor has been certified by MD Anderson Cancer Network, one of America's leading cancer care providers.
Cancer patients should look for this exclusive certification. It means that much.
It shows we've met MD Anderson's nationally recognized standards.
And that their guidelines and treatment plans can be shared with our patients right here locally.
Every week, we discuss challenging cancer cases with the experts from MD Anderson. And every week, we're so grateful our patients have access to this affiliation.
It's much more than a lapel pin. It's a beacon of hope.
Community Health Network. Exceptional care, simply delivered.
Our patients in the new cancer center will experience a very home-like environment, something that's very customized to them and to help them feel comfortable and welcome.
There are a whole host of elements that we call the healing environment that focus around patient empowerment. We give them control over whether the blinds are open at their own reach. We give them the thermostat where they can reach it. The light switches are where they can reach it, not necessarily the staff. We put things in places for them to be able to control their life.
The healing garden is very nice because it provides a bit of warmth and calmness as they're going through their treatments, as well as for families, since many of our treatments last all day. Patients' families are able to go out and enjoy that experience outdoors.
Positive distractions can be so very important in one's ability to manage and cope with the stress. And for some people, it's doing a Sudoku, or it's reading a newspaper or a book. For other people, it's actually creating something with their hands or doing something with their hands. But giving multiple opportunities to do that, and therapies centered around that in every way help us.
Remember, this is not just about the patient. Obviously, they're the ones who are suffering the most, but the family is going through that with them, and I think the Cancer Center is designed to make you feel in an environment that is endearing and caring.
I own and operate a family campground.
Dan was diagnosed with rectal cancer.
I spent the rest of the day crying. I absolutely wanted them to take back that word cancer.
I figure if we're going to fight cancer, let's get community on our team.
One of the things that community has is a navigator program.
And the Cancer Navigator would help us with all these terms that we didn't really understand. And that was very comforting to know that somebody was looking over our shoulders. I told Dr. Narayanan that Dan was the love of my life and that I was trusting Dan to his hands.
Our team has given him every chance in the world to be around for a long time. We're going to give you the best possible care and make it simple for you to understand.
And I just feel like I'm getting the best care available to me.
Community Health Network and MD Anderson Cancer Network. Exceptional care, simply delivered. Cancer can be relentless, but at Community Health Network, we've drawn a line in the sand. All 5 of our hospitals are now affiliated with MD Anderson Cancer Network, a program of MD Anderson Cancer Center. That means at each of these locations, you now have access to some of the world's most advanced treatment plans using MD Anderson protocols. Finally, we've got cancer surrounded. Community Health Network. Exceptional care, simply delivered.